Hi guys, I'm Balrik from Optimise Cardio, and I'm going to talk to you today about my 3 top tips or resources to use preparing for the clinical scenario. So the first thing that you absolutely need to know, which is hopefully fairly obvious, is ECGs. People get caught out by them every year, even though people I think are fairly familiar with them, obviously applied to cardiology. So it's really, really important to know ECGs well, but also be able to succinctly appraise them and come to a diagnosis. And the best candidates can also think about how the ECG may progress or change, which may then change their management. So I think it's really important to have a good understanding of ECGs. In terms of resources, we use them a lot in our videos and in our mock scenarios. And I would also suggest I know it sounds basic, but the ECG Made Easy book by John Hampton, and more importantly, the accompanying question, which I think is actually very comprehensive and very good and gives very good explanations as to the ECGs and some common pathologies. The second thing I think people should be aware of is the basic views and interpreting a basic report of echocardiography. Again, it comes up, both views and interpreting reports. So it's really important, I think, to know your 4 echo views and be able to spot common pathology. I think the ones that I would suggest at a baseline is knowing what an impaired LV looks like, knowing what pericardial effusion looks like on the signs of tamponade, knowing what dilated cardiomyopathy looks like, and some common valvulosis such as aortic stenosis or vegetation. Echo is actually a bit harder to find resources on sort of books, and online they can be a bit too detailed, some of the images and YouTube clips of echo that you find online. So actually I think one good way to engage with it is to go down to your local echo department in your hospital and just have a list of common pathologies that you want to look at images of, and ask them to help you pull out a few and just spend some time looking at them and looking at a few of their reports so you understand some of the basic parameters. We also use a lot of echo images, and a lot of my echoes on the website, and also on the course, so you will get tested on them, so do make sure you know them well. And yeah, that's definitely something that candidates can trip up on and have tripped up before. And finally, guidelines. I think you need to obviously know your clinical topics well, and you need to know not just your guidelines, but also the best candidates can be able to pragmatically interpret those guidelines and put them into place within a hospital or outpatient setting. And I think that we base a lot of our material on the ESC pocket guidelines, and you cannot go too far wrong if you know the ESC pocket guidelines. Word of warning, definitely don't download the full guidelines by accident. They're far too detailed. But the ESC pocket guidelines, which have a fantastic app, if you could flick through those and your management of common conditions be in line with that, and if you can even refer to a few of those recommendations, 2A or 1A recommendations, then you're doing incredibly well. And so I think the 3 things I would recommend are ECG knowledge, basic echo knowledge, and the ESC pocket guidelines. And I think it will serve you very, very well for the cardiology clinical stations, of which there are 2 now this year compared to 1 in previous years. So it's very important. I'm going to go through one cardiology clinical scenario to give an example of 3 cannot miss points, 3 5-star level registrar points. So the example I'm going to choose is Torsades de points and associated long QT, which is something that is, I think we understand very well at medical school, but candidates struggle with when it comes to interview situation, and not unfairly so, because it's not something we commonly, routinely come across in our everyday practice. So what are the key 4 pieces of knowledge that I think a candidate would expect it to know at interview? I think first of all, the ability to recognise the ECG of Torsades versus the ECG of monomorphic VT versus VF, and I think it's really important to differentiate between the three. It's something that can be quite difficult actually when you're on the spot, and we've seen that in previous years. So it's important to have that knowledge and be able to talk about the ECG of Torsades. Then in terms of management, I think it's very important to do the basic management, know when to give IV magnesium and know when cardioversion is indicated. And then in the other core piece of knowledge, I think, is to know how to look at the baseline underlying 12-lead ECG and to be able to talk through how you would measure the corrected QT interval and justify where you would be taking those measurements from on the ECG. And I think that's a fairly reasonable core piece of knowledge and cannot miss points that you'd be expected to know. And then in terms of the 5-star level points, I think a good candidate would be able to think about the causes of long QT in a sensible fashion on the spot, so breaking it down to acquired versus congenital, and be able to talk about the likelihood of a few of those based on the presentation and the underlying plasma history and medications, for example. Then I think moving nicely into this, the second 5-star level point would be to be able to succinctly talk about the medications they're on and common electrolyte abnormalities and know how to correct them. And I think knowing that and also talking about the possibility of overdose on medications and checking for drug toxicity or some way of monitoring plasma or urine levels for toxicity, I think is a very good 5-star level point not many candidates will get. And then in terms of the actual management of torsades, knowing that torsades is caused by R on T in patients that are bradycardic, it is certainly indicated to consider positively chronotropic agents such as isoprelin infusion and in some cases overdrive pacing to increase the rate to reduce the likelihood of R on T and further torsades. I think that's a impressive part of management to be able to talk about and a 5-star level point for sure. So yeah, in summary, I think those are 3 pieces of cannot miss: information recognizing torsades, knowing when to give MAG cardiovectic, and knowing how to measure corrected QT interval, and cannot miss knowing how to break it down to your acquired congenital causes of long QT and investigating a few of them, thinking about meds, overdoses, and electrolyte abnormalities and how to correct and investigate for those. And then in terms of more complex management, aspirin and overdrive pacing, I think is very impressive. Great, hope that was useful.